Hi, I'm Hannah. I'm going to talk to you about the integumentary system and the components, functions, and some clinical application. These are my note cards that I'm using to help. First, the components of this system is the skin, also known as the cutaneous membrane. And within that is glands, hair, and nails are all important components of the integumentary system. Next, a quick definition. The skin is a physical protector for our body and muscles and blood vessels and fat, everything beneath the skin. It protects, the skin also helps regulate body temperature. It helps with excretions and secretions. In nutrition, we absorb vitamin D through our skin, which is obviously very important with our serotonin and all around mood and our daily living. Next, there are a few layers to skin, first being the epidermis, which is the outermost layer of the skin. It's made up of squamous cells that provides a waterproof barrier and helps create a skin tone. Beneath the epidermis is the dermis layer, which is made up of connective tissue, hair follicles, and sweat glands. Also, nerve endings are within the dermis layer. Finally, the hypodermis is a deeper subcutaneous tissue made of fat and connective tissue, and that is the deepest, most layer of the skin. A little clinical application. I'm going to, hopes to be an RN someday. I'm an LPN right now. I'm working towards that degree, and I use knowledge of the integumentary system daily because the skin is a really great indicator of any problems within our health. For example, jaundiced skin is sometimes a indicator that someone might be in liver failure or a liver disease, or there's a problem with the liver. So it's great to have the knowledge of the integumentary system to know what to look for in clinical settings. Also, in relation to nursing, there are different degrees of burns which affect the epidermis and the dermis. So it's important to know what other functions of the body might be affected if the dermis is damaged or the epidermis is damaged. So within a first-degree burn, it affects the epidermis, and it's a very mild burn. It could be a sunburn. It's painful and red. A second-degree burn would affect the epidermis and the beginning layers of the dermis, which would result in the blister, more painful, more risk for infection. And then a third degree burn, which completely destroys the epidermis and the dermis, which would also in turn destroy the nerve cells and nerve endings that are located within the dermis. So it would be important to know how to treat a burn appropriately, how skin reacts to different medicines, or how someone's sensitivity to different things might be affected, how the nerve endings were affected if someone has a serious third-degree burn, infection control, and just the importance of getting skin back to its best physical shape and health. It's really important. So thank you for listening.